So did you say you are hungry? You are hungry? Well, we have not even started the class. This is just the 12. Anemia. Anemia is defined as 1. A reduction in red blood cell counts. 2. A reduction in hemoglobin content of the blood. 3. A reduction in packed cell volume or hematocrits. These 3 key parameters helps us to know when someone is anemic. So it is either a reduction in red blood cell count or a reduction in hemoglobin content of the blood or a reduction in the packed cell volume. The word anemia simply means reduction, decrease. Okay? The opposite of this is polycythemia, which refers to an increase in red blood cell count. Abnormal increase in the red blood cell count. There are 2 forms or classifications of anemia. Alright? We can classify anemia into 2 types. We have what is called the morphological classification and etiological classification. This grammar are too big. Morphological, etiological. When we talk about morphological classification, we are talking about the structure of the red blood cell. So, when we talk about the other one, which is etiological classification of anemia, we are talking about the cause. Etiology in College of Medicine simply means cause. What is the etiology of your cough? What is the etiology? What is the cause? What is the reason for that? Alright. Let's begin with the first one, morphological classification. Under morphological classification, we have number A, nomocytic, nomochromic anemia. Alright? Nomocytic, nomochromic anemia. Number B is microcytic, nomochromic anemia. And then we have the macrocytic, hypochromic anemia. Then we have the microcytic hypochromic anemia. So these ones are under morphological classifications of anemia. The etiological classification of anemia includes number A, hemorrhagic anemia. Hemorrhagic anemia. The cause of this anemia is due to excessive bleeding. Hemorrhage. Hemorrhagic anemia was derived from the term hemorrhage. Hemorrhage simply means excessive bleeding. So the loss of blood cell due to excessive bleeding, either by accident or by GIT bleeding. Hemorrhagic anemia. Number B is hemolytic anemia, excessive breakdown of red blood cells. Alright? This one can be seen in sickle cell patients because the lifespan of their red blood cell is decreased, and a lot of factors such as infections, malaria, typhoid can lead to the decrease or excessive breakdown of red blood cells in such patients, leading to hemolytic anemia. Then we have nutritional deficiency anemia, which is due to lack of certain nutrients in the diet. Alright? Maybe your diet is lacking iron, or is lacking folic acid or vitamin B complex. You're going to have anemia due to nutritional cause. So we shall talk about nutritional anemia later on in this class. And then we have aplastic anemia. Aplastic anemia. Exposure to UV ray or radiation can destroy your bone marrows, leading to reduction in red blood cell production, red blood cell count, and it will give you a type of anemia known as aplastic anemia. Alright. Anemia of chronic diseases. We shall come to that. So let's look at the morphological classification of anemia in details. Beginning with pneumochromic pneumocytic anemia. In this type of anemia, the mean corpuscular hemoglobin concentration is normal, and the mean corpuscular volume is normal. Alright? This type of anemia can be seen in anemias of chronic disease, hemolytic anemias, characterized by accelerated destruction of red blood cells. I mentioned that earlier. Okay, and then you have anemia of acute hemorrhage, excessive loss of blood. Aplastic anemia, characterized by disappearance of red blood cell precursors from the bone marrow. Generally, destruction of red cell or red bone marrows can lead to aplastic anemia and pneumochromic pneumocytic anemias. Okay, and then the next one is hypochromic microcytic anemia. This type of anemia, the MCHC, that is mean corpuscular hemoglobin concentration is low and the mean corpuscular volume is low. Alright? This is low, this is low. It can be found in iron deficiency anemias and thalassemia and anemias of chronic diseases. There are some diseases that can destroy your red blood cell, causing you to have anemia. For example, if you have kidney disease or kidney failure, of course, you're going to have anemia. Because the kidney plays an important role in the production of red blood cells. It secretes erythropoietin, alright, which stimulates the bone marrow to produce red blood cells. So if you have kidney disease, every patient that has kidney disease will definitely have anemia. Alright. For photochromic macrocytic anemia, the mean corpuscular hemoglobin concentration is normal. However, the mean corpuscular volume is high. This type of anemia can be found in vitamin B12 deficiency and folic acid deficiency. Alright? Okay. Let's look at other forms of anemia due to etiological classifications. Beginning with iron deficiency anemia. It simply means excessive loss of iron or the inadequate consumption of iron in the foods. There are foods that contain iron which helps in hemoglobin synthesis and of course in boosting red blood cells, such as plantain, right? Plantain contains iron, especially the unripe plantain. So, in iron deficiency anemia, it is a kind of anemia that is caused by iron inadequacy especially in the diet, or maybe problems with iron absorption from the GIT. You can have iron deficiency anemia. Women are at risk, and the reason is because of menstrual bleeding. Okay? Some women can have heavy flow on monthly basis, and the more you keep losing this blood due to menstruation, you lose iron and other electrolytes that can boost the blood volume. So menstruation has to be normal. If you have heavy flow, please, you need to do something about it. See your doctor and don't just sit there thinking everything is normal. Alright? Megaloblastic anemia is a form of anemia that is due to vitamin B12 and folic acid deficiency. You can have megaloblastic anemia. Okay? It can also occur in red bone marrow cancer. Alright? Or disruption of the red bone marrow. You can have megaloblastic anemia. Then we have what is known as pernicious anemia. Pernicious anemia is the kind of anemia that occurs due to the inability of the stomach to absorb vitamin B12 in the small intestine. Alright? When you start doing GIT physiology, you will understand that there are some intrinsic factors in the stomach that helps with the building up of red blood cell, absorption of vitamin B12. Anything that hinders the absorption of vitamin B12 in your GIT can lead to pernicious anemia. Also, foods that lack B complex or vitamin B can cause you to have pernicious anemia. So the treatment is simple. You simply take in B complex drugs, or you take in foods that contains vitamins, especially vitamin B. Alright. Hemorrhagic anemia. Hemorrhagic anemia. Hemorrhage simply refers to the loss of blood due to excessive bleeding that can be caused by accidents or GIT bleeding. And the loss of blood can cause reduction in red blood cell count and leading to a kind of anemia known as hemorrhagic anemia. So excessive loss of red blood cell through bleeding from the stomach, ulcers, menstruation, or by accident can cause hemorrhagic anemia. The next form of anemia is the hemolytic anemia. Hemolysis simply means excessive breakdown of red blood cells. The excessive breakdown of red blood cells is known as hemolysis. When the red blood cells are broken down excessively, the red cell count and the PCV becomes low, and it can lead to a type of anemia known as hemolytic anemia. Hemolytic anemia can be caused due to some hereditary defects such as sickle cell anemia. It can also be caused by malaria. Do you know malaria can destroy your red blood cells? And even the anti-malaria drugs you take can lead to excessive disruption of red blood cells. But all these things are transient. They are reversible, because after you have finished treating the malaria, your blood volume and red blood cells returns to normal. Okay? So, hemolytic anemia, like I said, may be due to parasites toxins, antibodies, and so on and so forth. Malaria infections, even hereditary situations such as in sickle cell anemia. For thalassemia, thalassemia and sickle cell anemia. These are something we are going to look at in details in this class. Sickle cell anemia and thalassemia. Okay? But it results from less synthesis of hemoglobin. Thalassemia results from less synthesis of hemoglobin found in population of the sickle cell anemia are due to hereditary causes, blood disorders characterized by red blood cells that assume an abnormal shape. Alright? Rigid sickle shape. The red blood cells of sickle cell patients is different in the shape from that of a normal person. We'll look at that in details. And then aplastic anemia results from destruction of the red bone marrow. Destruction of red bone marrow. The major causes are exposure to toxins, that is toxic substances, and gamma radiation. Okay? So these gamma radiations and toxins can destroy the red bone marrows, leading to a significant reduction in red blood cell production, which may in turn lead to reduction in red blood cell count. And then, when the red bone marrows are destroyed, definitely you are going to have a type of anemia known as aplastic anemia. Common symptoms of anemia. Common symptoms of anemia. The patient is easily fatigued and feels a kind of loss of energy. There's tiredness. Fatigue means tiredness. Loss of energy. The patient is always weak. Alright? Rapid heartbeats. That is palpitation of the heart. The heart is beating so fast than normal. Shortness of breath, also known as apnea. Respiratory apnea. Shortness of breath, headache, and then difficulty concentrating, dizziness, pale skin, leg cramps, and sleeplessness or insomnia. Alright, lack of sleep, insomnia. These are the common symptoms of people with anemia. People with iron deficiency anemia may experience the following symptoms. Number A, hunger for strange substances. Such as paper. You may see the patient eating paper. Some people are like that. They crave for ice block. Have you seen some people like they like ice block? Ice block. a sign that that person may be having iron deficiency anemia. They crave for death like sand. There are some of them who they pack sand from the backyard and they begin to chew sand. Yes, Oyibo is looking around, that's happened to her. So one common sign to know if someone has iron deficiency anemia is craving for substances such as, you're craving to chew paper, to eat sand, and to eat ice block. There's a way rain will fall and the sand will be smelling. You say, the aroma from this sand or mud, the aroma, you feel like going to chew sand. It's a sign of iron deficiency anemia. Alright? Upward curvature of the nails is another symptom of iron deficiency anemia. Alright? Soreness of the mouth with cracks at the corner is another sign of iron deficiency anemia. And then people with vitamin B12 anemia may have symptoms such as tingling, pins, and needles. Alright? Needle-like sensation in the hands and the feet. Sometimes it looks as if something is piercing your feet. Or like someone is using needle to prick your feet. Some of you must have experienced that kind of sensation. It happens to me sometimes. Okay? Vitamin B12 deficiency. Loss of sense of touch. Someone is touching you, you won't even feel it. It's another sign of vitamin B12 deficiency. And then you have clumsiness, stiffness of the arms and the legs, dementia, forgetfulness. Alright? Sometimes when you read and you forget, you may have vitamin B12 anemia, pernicious anemia. So no one take vitamin B supplement. Hallucination and others, schizophrenia. Okay, anemia can also have some form of complications ranging from neurological to the blood, to the heart, to the spleen, and other organs. So complications, especially those anemia that are caused by heredity. Such children can grow up having complications of their organs. Okay? Some of these complications may be fatigue, that is neurological complications, central nervous system, fatigue, dizziness, and feeling of fainting. In the eye, you have yellowing of the eye, jaundice. Alright? The sclera of the eye is yellowish, yellow coloration of the eye. Jaundice. Call it jaundice. And then you have the skin. The skin is pale, cold, and yellowish. On the respiratory system, you have shortness of breath. On the musculoskeletal system, you have weakness of muscles and feeling of loss of energy. On the intestine, the stool may change color. You have what we call the cord blood. Cord blood. Like when you go to stool, you see that the physics you are passing out is very dark. That is an indication that there is blood in the stool. Cord blood. That can occur mostly in people who have ulcers, that is gastrointestinal bleeding. And then on the blood vessels, the pressure is low. Palpitation of the heart, I mentioned that is rapid heart rate. Chest pain, angina pectoris. Tightness of the chest with pain, accompanied by shortness of breath. We may also have heart. Patients may also have a heart attack. Alright? And then there is splenomegaly, enlargement of the spleen in some anemic patients. The spleen disintegrates, disappears. Okay? Anyway, we shall come to all of this as we proceed. Alright. Hemoglobinopathies. We now want to look at sickle cell anemia and thalassemia in details. These two kinds of anemia can be classified as hemoglobinopathies. Hemoglobinopathies. Sickle cell anemia and thalassemia. These are anemia due to hereditary cause. And they are very serious conditions that needs to be given proper attention, especially to patients suffering from these defects. We have sickle cell patients and those with thalassemia around us. They are all around us. Some of them are our friends, some of them are our neighbors, some are our relations. They are all over the places. Some are in this class. So it's important you understand what sickle cell anemia is all about, the ways to maintain and prevent producing people with these disorders. All right? Before we go into sickle cell anemia and thalassemia proper, we need to first understand what hemoglobin is all about, because the topic is hemoglobinopathies. Hemoglobin, like you know, is found in red blood cells, and they are responsible for the red coloration of the blood, and it is this same hemoglobin that helps us to deliver oxygen to our cells, the tissues, and organ system. That is primary biology, hemoglobin. Now, each hemoglobin molecule, of course, is made up of four hem. It is made up of 4 hem groups. And the 4 hem groups are surrounded by globin groups. Hem contains iron. Globin consists of 2 linked pairs of polypeptide chains. This structure on the board explains everything about the structure of hemoglobin. There are 2 parts. The iron-containing part, or the hem part. This part where they wrote iron, this is the hem part. And you have the other part which is the globin part. Alright? Hemoglobin will have 2 beta chains and 2 alpha chains. So you need to go and look at structure of the hemoglobin molecule. The hemoglobin structure actually is made up of alpha chains and beta chains. Alright? The alpha chains and the beta chains. Alpha chain is made up of 141 amino acids. The beta chains are made up of 146 amino acids. Okay? Good. Now the HbA, alright, normal adult hemoglobin, like I said, it has 2 alpha and 2 beta chains. There is also what is known as fetal hemoglobin. This one has 2 alpha chains and 2 gamma chains. And we have HbA2, made up of 2 alpha chains and 2 delta chains. Abnormal hemoglobin metabolism. These are when we talk of abnormal hemoglobin metabolism. We are simply talking about the abnormalities that arises from hemoglobin, and then the word hemoglobinopathies. It is from these hemoglobinopathies or abnormal hemoglobin that gives rise to the hereditary disorders such as sickle cell anemia and thalassemia. Okay. So when we talk of abnormal hemoglobin metabolism, they are genetic diseases or disorders due to hemoglobin molecule abnormalities in which individuals inherited two abnormal hemoglobin from one or both parents. There are some changes in the hemoglobin molecule. Alright? So, mutation, that is changes in hemoglobin molecule, can be either qualitative or quantitative. Alright? So in qualitative mutations, defects of hemoglobin chains leads to amino acid substitution or deletion or elongation. So it is either one amino acid is being substituted for another, or it is deleted completely. For sickle cell anemia, amino acid is being substituted. For thalassemia, there is deletion of either the alpha or beta chains of hemoglobin. Alright? And then for quantitative defects, you have abnormal alpha and beta ratios. Anyways, this one is too heavy for you, right? Don't worry, I'm going somewhere. Okay. Let's just dive into sickle cell anemia proper before we begin to look at the differences between sickle cell anemia and thalassemia. Okay. Sickle cell anemia. It is a genetic disorder that affects the erythrocytes, causing them to become sickle or crescent in shape. Look at this structure here. Let's call this 1, let's call this 2. This is normal, this is abnormal. The effect of this condition due to an abnormality of the hemoglobin molecules found in erythrocytes. Sickle cell anemia is an inherited form of anemia. And it is a condition in which there are not enough healthy red blood cells to deliver adequate oxygen throughout the body. The red blood cells in sickle cell patients is low. And because of these low red blood cells and their excessive destruction, in the system or circulation, oxygen cannot be delivered inadequate to the body cells and body tissues. The red cell, or red blood cell of a sickle cell patient becomes rigid and sticky. So they stick to the arteries, preventing free flow of blood. Alright? If you look at the diagram, you will appreciate that this is normal hemoglobin inside the red blood cell, and this is abnormal. This is 2. Alright? You can see that the hemoglobin does not have the right structure. The red cell in the blood vessel has some kind of, what will I call it, projections, causing them to stick to the blood vessels. And this can prevent free flow of blood and occlusion of the arteries, causing them to have bone pain crisis. And if medical attention is not given to them, they can also have organ complications before they grow to adulthood. Some may even die before adulthood. The essence of this is for you to appreciate that sickle cell patients acquired defective genes from both parents. So when a child is born a sickler, first thing you need to know is that it is not the fault of the child. Because he or she came into this world as a sickler, not knowing what it is, but he just understands that he suffers from a lot of bone pain crisis and he's always in the hospital receiving treatment. But whose fault it is? The parents. Did you say the parents? Is it really their fault? Their fault. Okay. How is it their fault? How is it the fault of people who fell in love? How? So somebody cannot fall in love again and have children. I'm asking, how is it their fault? Is it their fault? It's not their fault. They only fell in love. After all, love is blind. Is love not blind again? Okay. Now, the truth of the matter is, it is good to fall in love. But I love you, baby, I love you, boo, is not where it starts and ends. Yes, that is the truth. Nobody says you should not fall in love. But there are certain things you have to do and check before falling in love. This is how sickle cell children come about. First, we have what is known as genotype. Every person will fall under these genotypes. You are either AA, AS, or SS. There are other variants of genotypes. Someone can be AC. Yes. Someone can be CC. Alright? So there are forms of genotype. And if you have a genotype that is AS, that simply tells you that you are a carrier of sickle cell traits. If your genotype is AA, for example, it means you are not a carrier of the sickle cell traits. Now, the whole of this diagram tells us how sickle cell children came into existence. This is Mr. Paul, all right, Paul, and this is Mesoma. Let's take, for example, they fell in love, and they got married in the future. And if, for example, Paul has a genotype of AA, his genotype is AA, and Mesoma is SS. For example, do you think they can get married? Yes. They can get married? Yes. Can they get married? Yes. Paul, will you marry Mesoma if she's SS? Huh? Will you marry her? You will not. Mesoma, will you marry Paul? You will not. Go and sit down. Both of you must marry. We don't want to know your genotype. Both of you must marry. Let's say, for example, they are married. Paul is AA, Mesoma is SS. Now, they are going to give birth to children who will all become carriers. Alright? Because by the time Paul donates one of his genes, A, to the child, and Mesoma donates one of her own genotype to the child, it becomes, if you cross-match that, the children will all be AS, AS, AS. Would they have sickle cell crisis? No. So these children are safe, although they are carriers of the sickle cell threat. But they won't have manifestation of sickle cell crisis. Not that they can't fall sick. Of course, every human being will fall sick. You can have malaria, you can have any form of illness and be hospitalized. But what I'm talking about is their kids are safe and they will not begin to have sickle cell crisis. Good. Let's take, for example, one of the male kid has grown into a man. This is Paul Jr. Paul, his first son. He has grown into a man, and he knows fully well that he is AS, because he inherited one A genotype from his father and one S from his mother. So he is AS. And then he gets into campus, and then he met a beautiful, fair, princess, charming, hot lady. And then he approached the girl, and this girl is SS, but she didn't tell him. And because they were so madly in love, they never bothered to check their genotype. So they got married. Alright? Or maybe the girl even told him. But he was like, I am Mr. Paul Jr. That is rubbish. All I'm saying is, be my wife, be my queen. I'm in love with you, young lady. I don't care what your genotype. In fact, my fate does not see every human being as whole. Or maybe my papa says he will pray for us, and then we will miraculously produce children that are AA, even though you are SS and I'm AS. And they went on with the marriage. Now, they gave birth to 4 children. 2 of them are AS, and the remaining 2 came out as SS. Good. And before they knew what was happening, these 2 SS were falling sick almost every week. And each time Paul Jr. goes to the office, before he even sits down to begin his work, his phone will ring. Your child is in the hospital. He closes his office, he rushes to the clinic. The same thing with his beautiful wife. Before you go to your office, to her office, or maybe her shop, they ring her from the hospital that your child is hospitalized, receiving drip, and receiving treatment. Both of them will keep rushing to the hospital. Before they knew it, they are faced with reality. And love, as at that point, will fly out of the window. Because they will now begin to regret, why did they do the needful or the right thing before getting married? Now, these children who are now SS didn't create themselves. They were created by their parents. Their parents brought them into this world to begin to suffer from sickle cell crisis. That every now and then they are always at the hospital receiving treatment, suffering from things they know nothing about. And that is why I said, I love you, baby. I love you, boo. Yes, baby. Yes, boo. It's not where life starts and ends. You really need to begin to do the right things and begin to ask the right questions. When a man approaches you as a young girl and he starts winding your head and telling you all the sweet things in the world, calling you my baby punch, sugar punch, will you marry me? Will you be my queen, the mother of my unborn kids, and all those stuffs? The first thing you should ask is not whether he has a car, because some of you are so carried away. Someone is coming to you, approaching you for a relationship, and even asking for your hand in marriage. And you are looking at the kind of shoe he wore first. This shoe, is it Italian Abba made? And then you are looking outside the window. Is it car he brought that big keke? Is it keke that dropped him? Or you want to find out if he really loves you. And then you tell him, honey, I'm bored, I want ice cream, shawarma, chips, and chicken wings. That is the first thing you look at. I think when someone is talking you into relationships and marriage, even there are some guys here approaching all of you in this class. And there are some girls eyeing some of you boys. Whether you believe it or not. Some must have made love advances to you. I think the first thing you should ask is, what is your genotype? No, he comes to you. Mesoma, every time I see you, I go crazy. Yes. And then she'll be like, oh, really? Oh, I'm blushing. Good. And then you just enter the relationship without asking the right question. At least, you love me, okay, fine. I think I like you too, but what is your genotype, Oga? You too, before you even ask a girl out, try to find out the genotype of the girl. You ask her. Many of them will lie about it. They will lie about it. But you should devise means of knowing the genotype of any person you are interested in. Because in the course of relationship, anything can happen. You might be sneaking out from classes and meeting in the bush, and before you know it, pregnancy has happened. And then you go and defer your admission for 1 year till you put to bed. And if you discover that the child is SS, you begin to run helter-skelter. So it is very important for you to know your genotype. If you don't know your genotype in this class, and you have a boyfriend or a girlfriend, break up today. Just break up. Go and check it first, and then come back. It's serious. It doesn't take you anything to know your genotype. How much is genotype test? How much is it? With at least 3,000 naira or less, you have to know your genotype. And we have a clinic there, we have a lab there. Simply go and find out your genotype. In fact, you should know your genotype from birth. If Nigerians are doing the right things, as soon as the child is born, there are a series of laboratory findings that is carried out on every child. And from the day you are born, everything about you is known. That is how it works in the Western world. In fact, the Western world, they don't even talk about sickle cell and thalassemia disease. They have gone past that level. It is only here in Nigeria that a young boy and a young girl will not know their genotype, and they are busy falling in love up and down without knowing your genotype. It's an aberration. We have people who are sicklers, and if they tell you their story, you will know that what they are going through is not easy. There are many of them, even as students, it's not easy for them taking care of their health and then undertaking their studies. It costs a lot of money to maintain a sickle cell person. Because sometimes, for those who are students, the money they give them for feeding another thing goes into their routine drugs. It goes into paying their hospital bills. And it's not even their fault. So we really need to look for a way to see how we can stop bringing forth kids with SS genotype. If after today you have received this lecture, and in the future you get married and you produce a sickle cell child, you will go to hell. Not just hell, the hottest part of hellfire. Yes. Because it is not fair for you, because of your selfish interest, you call love. I love you, boo. I love you, boo. I love you, baby. You now produce a child that will be suffering from bone pain crisis every day, taking drugs every day, and is not even sure of the next day. God will not forgive you for that. I didn't say you should not fall in love. Fall in love, but know the genotype of your friend. You must know it. Anyways, those who are SS are not less human beings. They are also humans. Because I discovered over the years that some of you, because you think you are AA or you have a very good genotype, then you are a superhuman. And then you begin to pride yourself around. I am AA. Rubbish. The truth of the matter is, if you are healthy, kneel down and thank God. Alright? But if you know someone who is maybe SS or have any clinical condition, then the best you can do as a human being is not to begin to, bad mouth them. You assist them financially, spiritually. Pray for them. If you are in a position to help them get good medical help, you do so. Because in the end, whether you are AA, AS, or SS, everybody will die. I have seen people who bad mouth those who are sick simply because you are healthy. And I just look at you and laugh because you are doing that out of ignorance. The fact that you are healthy today does not mean you cannot fall very sick tomorrow. Mutations can happen. There are people who were very healthy and before they knew it, they've had one disease, maybe kidney failure, due to mutations. And then they keep going to the clinic for dialysis, and they fly themselves abroad for treatment, and in the end, they still die. So what is the point? You see someone who is a sickler, okay, because you know the person is a sickler, does that give you the right to begin to use derogatory terms or such as only the person, you have half-life or you will soon die? Or because the person is falling sick every day and the person is hospitalized, you go to the person and every day you is sick, every day you is sick. Every day you is sick. Die, no one die. There are people who I don't really understand. You don't want to kill the person before it's time. You don't know the kind of words that come out of you can kill somebody. That is why you need to be careful. You need to be careful. I have studied people with sickle cell disease, and I discovered that, look, these children are smart, very brilliant people. If not for their clinical or health conditions, you will not even near them in terms of book or academics. It's just because they spend more of their time at the hospital. And if you really study them, you will know that even on their sick bed, they are reading. They are reading. So think about it. Assuming they came out with AS or AH genotype, do you think you will smell them? You will not. They are brilliant set of people. So if you know them, assist them in every way you can. Help them to succeed. Alright? Because nobody knows tomorrow. Yeah. Okay. The light is gone. Please let me just drop this before we call it a day. We still have a lot to do under sickle cell anemia. But I think in our next class, May 24th and 25th. Okay, 25th. Okay, you don't want the class of the 24th. Okay, 25th. Okay, you don't want it on 25th, you want 24th. Anyways, if you like travel or no more, if you like to travel or no more, our next class will be on the 24th or 25th, or on the 24th and 25th. I'm going to communicate with the course reps. Give our full price and yes, now, after all, it's Christmas Day. We will learn and celebrate, but in class. In class. You are all college students, so no break for you. Alright? So lastly, before I go, while I was an undergraduate student, I think the doc who was making blood physiology, you know, he came to class, and then when we got to hemoglobinopathies, he made certain statements that we really need to redress. All right? So one thing he said about the sickle cell patients is that there was no need investing in them because definitely they must die. Even before they get to adulthood. And you know, today I'm a lecturer and I'm in class. And for me, that statement would have to be redressed because that dog was wrong. Alright? We have sicklers that have grown to adulthood and even to old age. So it it is not true that if you're a sickle cell or a sickler, or you know someone who is a sickler, that person will die. These days, there are a lot of information and research about the sickle cell disease and even thalassemia. I have also seen sicklers who have lived without having organ complications for many years. In fact, the last one who celebrated her, was it 90th birthday in Lagos? A sickler, a woman, 90th birthday in Lagos. So the truth of the matter is, with good Medicare, sicklers can survive. Good Medicare. What is there? If you have crossed the age of 18 without any organ complication, you will survive. Live your life. Or if you know them, encourage them to live their lives, and you see that most of them will become greater people in the society with good Medicare. Triggers for sickle cell crisis. Yes, it's true that they have crisis and it can be very excruciating. But if you continue to take your routine drugs and continue to prevent malaria and infections such as typhoid, you may reduce attacks drastically and live your life. Alright? So that is an error. Sicklers are human beings and they can live amongst people in a society and they can grow to maturity and to even old age. Okay. Our next lecture will be on the 25th. So we are going to celebrate Christmas here. If you have questions, you can ask. Otherwise, you can call it again. Questions? Yes. Chalk.
Not chalk for body, but that one is just yeah, because I had that thing reduce blood.
He used to do what?
Reduce blood.
Reduce blood.
No,
okay. She asked about those people that like taking Uzu. Is it Uzu? Uzu. Okay. That she had that thing used to reduce blood. But most pregnant women likes taking that in Uzu. Uzu is made up of what? What is the ingredient? Clay, soil, sand. Sand. Okay, why does pregnant women like taking it? Huh? I can't hear you. Those of you that have been pregnant before, tell me, why is it that pregnant women like taking news? Huh? They are what? Someone should come and tell me now. See that? Huh? Because me, I don't know why they like news. It reduces salivating, it helps the baby to grow bigger. Spitting. It reduces spitting. So doctors will now prescribe Uzu for you. You are pregnant now, you go for antenatal care. And after seeing the nurses and the doctors, they say, they will prescribe Uzu. Well. There is no known research that Uzu reduces salivation or have any benefits for both the pregnant mother and the baby. I've not seen any scientific research regarding that. But a lot of women take Uzu during pregnancy, and that could be craving for useless substances in pregnancy. Because number one, there is what we call pregnancy-induced anemia. Alright? It could be that, of course, during pregnancy, the woman is anemic. Every woman is anemic during pregnancy because the baby in the womb draws a lot of iron and other electrolytes to itself. And this thing comes from the woman's blood to the baby through the placenta. So, but the proper thing to do is to take more iron-containing foods, vitamin B rich foods, and folates or folic acid supplements of folic acid rich foods. That is the proper thing to do. Not taking Uzu. The crave for consumption of Uzu by pregnant women may be due to iron deficiency. Alright? And that is what, pregnant women crave for a lot of crazy things. A lot of crazy things. It is due to iron deficiency. The pregnant woman can say she don't want to eat food in plate. So might go to that waste bin and start looking for spoiled bread. So a lot of things happen during pregnancy. So I'm not surprised that during pregnancy, African women, particularly those in Nigeria, will be taking things like those, claiming that it helps them to reduce salivation or whatever. I'm not surprised. So if you monitor that woman very well, She might be going to the backyard to eat sand. What is the difference between uzu and sand? What is the difference? Salt. It's the same thing now. You pack sand, put it in a plate, add salt to it. And pour water and then mold it. It becomes uzu. So I'm not surprised. It might be linked to iron deficiency, anemia. Alright? Okay. Another question?
Why is it that I'm even here? I can't hear you.
So why is it that people tell patients don't prescription? Like they're told them taking iron with their body. You say iron deficiency.
For sickle cell, they told them not to be taking iron. Iron containing supplements. Yes. Yes, she's right. For sicklers, you don't prescribe a blood tonic that contains iron. Or you don't give them iron supplements. The reason is simple. Because of hemolysis and excessive breakdown of red blood cells, they release a lot of iron into the circulation. So their system already contains a lot of iron. And iron is not something you just excrete easily. Like that. So if you give a sickle cell patient iron, sometimes the doctors may restrict them from even taking plantain. Because plantain contains a lot of iron. But most parents would think that, okay, since it has to do with blood, and foods like plantain can boost blood cells, they erroneously or out of ignorance continue to give their children unripe plantain, not knowing that it will affect them the more. Because by the time you continue to give iron-containing foods or supplements, that child will now begin to have excessive iron in the blood. Alright? Excessive iron in the blood. It can lead to organ damage. That excess iron in circulation can lead to iron damage. And then that child may begin to have organ complications. And you may lose that child. So it's best you don't give them anything that contains iron. Their blood tonic is different. If you look at the blood tonic they take, it doesn't contain iron. It can contain all other essential, non-essential amino acid, B complex, folic acid, vitamin C, and so on and so forth, but iron must not be there. Alright? So, any other question? Yes? And then please, the attendance list should be on this table. Course reps. Any other question? Question? Alright, come forward.
Okay. You want to ask question?
Yes, sir. Hello, sir. Sir, what about for those that were married ignorantly? What can they do about it?
Hmm?
Like for those that are married, like somebody
Put the
that's
mic.
okay, somebody that is married, somebody that is SS. Okay. After the marriage, like what can they do about it?
Okay, you marry someone that is SS, unknowingly. What can you do about it after the marriage? Somebody said separate, divorce. Well, in this age, you don't just get married without checking your genotype. I think even churches will send you to the hospital to do some tests. Okay? So, but if you get married to someone that is SS, or you got married to someone that is AS and you are AS, there's nothing any person can do about it. You're already married. So if you don't have children and you discover that maybe you are AS and your wife is AS and you don't have children, well, it's a 50-50 chance, because your wife can get pregnant and the child may turn out to be AS. That means that child is safe. The child can also turn out to be SS. Alright? But medically we advise people who are carriers not to get married. Because sometimes a lot of things are happening. People get the wrong information. You know you are AS, your wife is AS, and then your pastor is telling you, go ahead and get married, I'm going to perform a miracle service for you, and your papa is telling you all sorts of things. When the problem starts happening, papa will not be there. It is you that will be running helter-skelter. Papa will not be there. All your advisors will not be there. It's the truth. So, if you have children that are already SS, well, you try your best to manage. Give the child good Medicare, and that child will survive. There are a lot of breakthroughs in medicine. Now, you know why people die out of sickle cell disease was because those days people don't know about sickle cell disease. So they don't know. So but now there's a lot of information. There are ways to manage such patients medically. Alright? So if it happens and you don't know about it and you're already married, then you and your wife should decide on what to do. Whether to go ahead to have children or not. Because you know sometimes they will say it's 50-50 chance. But I've seen couples. The wife is AS, the husband is AS, and all their children are SS. Yes. So don't allow any person to deceive you. Alright? You really have to know your genotype before you go into marriage. All right.
I heard somebody say that medically there is an intervention for this thing. So I think we talked about something like transplant. So I want to verify it with you. And second, can't genesis handle it?
And
Genesis, is there any way that they can like recode the gene and maybe get back right?
Well, we'll start from the last. Genetic research. Research are still ongoing to completely eliminate sickle cell threats, sickle cell disease. Okay, in fact, I think I came across one article for cure, treatment of sickle cell disease in the United States. But I've not really opened that article to read. But there are research that are still ongoing concerning that. And then your first question was bone marrow transplant. Good. Bone marrow transplant is another form of therapy for sickle cell disease. But you must understand that is a 50-50 chance. Alright? 2. It is very, very expensive. How many couples with sickle cell children can afford a bone marrow transplant in Nigeria today? It's very, very expensive. And that is why most people, you can't even afford to buy routine drugs for your children who are sicklers. All the money you're supposed to use to feed and do other things is going into the health of the child. And then you're talking of bone marrow transplant that costs millions. So it's not that easy. So it is very, very costly. The third thing you need to know is that even if you successfully do a bone marrow transplant, it doesn't change your genotype. Yes. If you are SS or your child is SS and you do a bone marrow transplant successfully, it doesn't change the fact that you are SS. What bone marrow transplant does is that after the transplant, you begin to produce normal red blood cells. Okay? And then the bone pain crisis stops. But if you go to check your genotype, you still remain SS. Because that SS came from gene mutation. And there is no scientific research, to the best of my knowledge, that have been, established to change that gene mutation to date. Alright? Okay. Any other question?
I'm not hearing you. They want to ask to take the mic.
I want to know the difference between number of blood volume.
Normal.
Number of blood and then blood volume.
Number of blood and blood volume. The answer is already in the equation. The number of blood. You're talking of red blood cell count. Blood volume, you're talking of PCV. Except you're talking of the whole normal blood volume in a healthy adult, which is 5 liters. Alright? But if you are talking of number of red blood cells, we are looking at the number of red blood cells that is present in a whole blood. We are talking of volume of red blood cell, that is PVC, packed cell volume. We are talking of red blood cell expressed in the volume of red blood cell expressed in percentage. We are going to understand this more in practical classes or sections. One last question. Okay.
In the family, if the father is AA, then the mother is AS. So, the first child is AA, then the second child is AS. So I'm asking, is it possible for the third child to be AS?
The mother is what?
The mother is AS, the father is AA. So
The mother is AS, the father is AA. And the first child is what? AA. Second child is AS. It's possible. Yes?
is it possible that the father is AA, the mother is AS? Is it possible for the whole child to be AA?
It's possible. It's possible. No, it's possible. Depending on the number of children. It's also possible for the child to be AS. It's possible. Yes. If you had asked me that the mother is AA and the father is AS and one of the child is SS. Listen. Mother is AA, father is AS, one of the child is SS. Is it possible? But in some families, it has been discovered that it occurs in some families. So what went wrong? It means that the mother will have an assistant boyfriend somewhere, an assistant husband somewhere. Let's say mother is AS, father is AA, and they have one child, or they have 2 children. One is AA, one is SS. Mother is AS, father is AA. And this